Hello, this is Denise Napoli reporting from the American Academy of Neurology in Chicago for Elsevier Global Medical News. I'm here with Dr. Alina Solomon, who's ready to talk about cholesterol increases in your 40s and the link to Alzheimer's disease. Dr. Solomon, would you summarize your findings for us?
It is an observational study of almost 10,000 persons. It's a large and diverse multi-ethnic cohort of both women and men who were members of the Kaiser Permanente health plan. And they underwent health evaluations between 1964 and 1973, when they were between the ages of 40 and 45. And they went on to remain in the same health plan through 1994. Between 1994 and 2007, we obtained their most recent medical records and found that about 500 persons had received a diagnosis of Alzheimer's disease and about 162 diagnosis of vascular dementia. And we related their cholesterol levels at midlife to the risk of developing Alzheimer's disease later on. And we found that persons with higher cholesterol levels had an increased risk of Alzheimer's disease. And there was a similar trend for vascular dementia as well.
Did you measure their cholesterol only once throughout that period?
Some persons did have several measurements during that time and some did not, so we decided to take the first measurement for everybody and relate it to their subsequent dementia risk.
Did you find that there was a different increase in risk for people whose cholesterol levels were over 500 milligrams?
There were no persons with cholesterol levels over 500 milligrams in our cohort, and I must say that 500 milligrams is an extreme value. And if you ask me what happens to a person with cholesterol levels above 500 milligrams, well, without treatment, the first thing that's likely to happen is one or more serious cardiovascular events. And without treatment, it is actually questionable that such a person can reach old age.
How does this compare for other risk factors for dementia, like smoking or drinking?
Well, smoking and drinking are the results for smoking and drinking are a bit controversial, but I would say that the risk of dementia related to cholesterol is similar to the risk related to hypertension or obesity. For smoking and alcohol, for example, the problem is that there are studies showing that excessive alcohol consumption increases the risk of dementia, but there are also studies showing that moderate alcohol consumption may be protective. But we don't know, is it the alcohol per se, or people who drink alcohol moderately tend to have a moderate lifestyle in general. So is it their lifestyle or is it the alcohol? We need to study that more.
Thank you very much, Dr. Solomon, for sharing your findings. This is Denise Napoli with Elsevier Global Medical News.